Hello and welcome to Medical Dialogues. I am Dr. Nandita Mohan, and today I will be taking you all to explore the world of rare diseases, and my topic for today is Wiskot Aldrich Syndrome. Now, to give us an in-depth knowledge about this rare disease, we have with us today Dr. Anand Narayanan, who is an associate consultant in pediatrics. He also specializes in neonatology, pediatrics nephrology, pediatrics cardiology, pediatric critical care, immunization, as well as adolescent care. So welcome to Medical Dialogue, sir. It's really a privilege to be interviewing you here today.
Thank you so much, Dr. Nandita. Thank you for inviting me.
Great. Now, sir, as we're talking about rare diseases, we're talking about this new disease that we just encountered or we just came across, that is the Wiskot Aldrich Syndrome. So if you could just briefly explain to our viewers, what is Wiskot Aldrich Syndrome and why is it classified under a rare disease category, as in why is it a rare disease?
Right. So it's a very apt question, actually. Wiskot Aldrich Syndrome, it is a genetic disorder which only affects boys. And it affects the immune system of the individual as well as the skin and the platelets. So it is basically a triad which involves skin, the immune system, and the platelet counts. And it is classified as a rare disease because its incidence is very low. It is currently seen that the incidence rate of Wiskot Aldrich syndrome is only 1 in 1 lakh individuals. So out of a lakh individuals, only one will have chances of getting or having Wiskot Aldrich syndrome.
Great, definitely, sir. 1 in 1 lakh is a rare incidence altogether. Now, you're explaining about this in detail. If you could just tell us what are the genetic causes of it is, and how is it inherited in the first place?
Okay, Dr. Nandita. So Wiskot Aldrich syndrome, as I already said, it's a genetic disorder. It occurs because of a mutation in the gene. It's called as the Wiskot Aldrich syndrome gene, WASp gene. Now, this gene is on the X-linked chromosome. So when this gene gets, when there's a mutation in this gene, it codes for a protein called as a Wiskot Aldrich syndrome protein. Now, this WASp protein, it plays a very key role in the actin framework of the cell wall, or we can see the cytoskeleton. So when that protein is affected because of the mutation in the gene, it alters to its products. It alters. So from varying from absent production of the WASp protein to decreased production, we will have manifestations like immunodeficiency or decrease in platelet counts and skin manifestations. So that is why it occurs. That is how it occurs. And it is X-linked inheritance. It means only in males it will be manifesting. In females, it might also be there, but since they have 2 copies of X chromosomes, mostly they will be carriers only. They will not be manifesting the disease.
Okay, understood, sir. That's why it is definitely a rare one, and it is a genetic, as you mentioned, it is an X-linked genetic disorder. Now, right. If you just mentioned it is basically a clinical triad, if you could just highlight that on a little bit more detail, the symptoms as well as detail of the clinical manifestations, what features one must look out if they are affected with Wiskot Aldrich syndrome.
Yes, as I said in the beginning, that Wiskot Aldrich syndrome is characterized by a triad. The triad includes, one is eczema, second is thrombocytopenia, and third is recurrent infections. So if you have any patient who is having recurrent viral and bacterial infection in combination with skin manifestation like eczema, and having a history of bleeding following a very trivial trauma, or history of minute petechiae on the entire body, then you should always think of Wiskot Aldrich syndrome. And if it's a boy, you should definitely, if you're getting all these 3, or at least 1 or 2 of them, you always keep Wiskot Aldrich syndrome as one of your differential diagnoses.
Okay. Now, sir, coming to the diagnosis aspect, now you mentioned about the clinical features, the symptoms or manifestations that one must look out for in the early stages. Even as you mentioned, out of the triad, if even 1 or 2 of those manifestations occur, then one must consider this as a diagnosis. Now, coming to the diagnostic aspect, what is the diagnostic criteria for Wiskot Aldrich syndrome, and how do you guide the testing process for such individuals?
First of all, you should keep this as a differential diagnosis in those patients who are presenting with the triad. And it starts from the basic investigation of a complete blood count with a peripheral smear. Now, in complete blood count, the first thing you will find is a decreased platelet count. or means a low platelet count. Now, when you see that on a peripheral smear, and if you're finding it small platelets, means the size will be small than the usual one, and then this is one of the criteria where you can suspend you when you should think of Wiskott-Aldrich syndrome. Now, other blood investigations which can be sent are the immunoglobulin levels. In Wiskott-Aldrich syndrome, it is seen that immunoglobulin M levels are are often low, and IgA and IgE levels are increased. In addition to that, we can also go for a flow cytometry where we can detect for the WASp gene mutations, as well as we can also go for a whole exome sequencing where we will be able to identify the mutation responsible for the WASp gene protein decrease number or decrease production. So we have one is as basic as a complete blood count with a peripheral smear. Second is an immunoglobulin levels. Third is a flow cytometry and a whole exome sequencing.
Okay, understood. Great. Now, so coming to the complications aspect of it, we've come to the diagnosis part. We've understood what the manifestations and the primary symptoms that one must have when they're diagnosed with Wiskott-Aldrich syndrome. Now, what are the complications, most common complications, if you may highlight, that is associated with this syndrome?
Well, the complications are actually related to the manifestations itself, that they can have very refractory eczema, and they can also have complications because of thrombocytopenia, like frequent bleeding after trivial trauma. At times, significant bleeding can also manifest, like in the form of intracranial bleeding. And it has also been seen that at times autoimmune complications, like the immunity of the body or damages the red blood cells of the body itself, and they can also have the effect on the vessels. At the same time, it has also been seen that there is a higher risk of development of hematological malignancies like leukemia in patients with Wiskott-Aldrich syndrome over long term.
Okay. So complications, as you mentioned, if I need to concise it, it will be according to the manifestations that they show, and that will be according to that the complications will lay out. Now, coming to the next aspect, if I talk about the management part, the treatment part, how do you manage and treat such syndromic patients? What is the management?
Well,
is there any management protocol that is laid out?
Yes, actually, the management depends upon again this is the manifestations which we have. Suppose a person is manifesting with a refractory eczema, then you should treat on the lines of eczema by means of a topical moisturizing cream or by means of topical steroids. Or if it's a refractory eczema, even need for oral steroids is also important. At the same time, in case of thrombocytopenia, where blood counts are remaining persistently low, frequent platelet transfusions are also required. At the same time, now recently, intravenous IV immunoglobulin infusions every 3 to 4 weeks are advised so as to decrease the chances of recurrent infections. So this is how Wiskott-Aldrich syndrome is usually managed.
Okay, so now say there's been recent research on bone marrow or even stem cell transplantation in the treatment of Wiskott-Aldrich syndrome. What is your say in it?
Yes, very aptly said, Nandita. The stem cell transplantation has been very good, has shown a good results in case of Wiskott-Aldrich syndrome. Prior to this, the long-term survival in patients with Wiskott-Aldrich syndrome was only 60-65%. After this, it has very much increased, as good as 80%. Now, it has seen that in patients who are getting HLA matched hematopoietic stem cell transplantations, the survival rate has increased to as good as 70 to 80%. So it is a definitely good thing in patients who are getting a stem cell transplant.
Great, then definitely, sir, as the percentage you mentioned, 70 to 80% is definitely a good number. And if that comes into, as technology is progressing, if this kind of management protocol also improves, then the life expectancy is definitely going to be better. Now, so coming to the next aspect of gene therapy, since we are talking about this rare genetic disorder, and you said it's an X-linked disorder, so are there any risks or benefits of gene therapy for patients who are suffering from Wiskott-Aldrich syndrome?
Yes, currently the research is underway in cases of gene therapy for Wiskott-Aldrich syndrome, but it is in its very early stages, so it is very difficult to identify what risk does it pose. Initially, it is only in its initial trial phases, trial 1 in clinical phase 1 and 2, and there was one study which was done in few patients in case of gene therapy, where by means of the the gene was inserted, and then the inserted hematopoietic stem cell transplant with the altered gene were infused into the patients, and they showed good response. And they showed improvement in their eczema and also improvement in the immunodeficiency, thus decrease recurrent infections. But still, it is very early.
Okay, so definitely there is more research which is needed in this field, I think. Then, lastly, Dr. Narayanan, if you can just highlight on the potential long-term outcomes for patients who are suffering with Wiskott-Aldrich syndrome.
Well, the long-term outcomes have greatly improved after the advent of stem cell transplantations. The survival rate has increased as good as 90%. But the one important thing is that the patients should be aware of symptoms when they occur, that they should go and refer or consult with a physician or a pediatrician. Like, they should be aware of symptoms like increase in their eczema symptoms, or when they're having increased bleeding tendencies or increased bleeding after trivial trauma, then they should go and consult a physician. And they should be told about appropriate skin care. And one more important, and in females who are carriers, they should be told, and they should have genetic counseling, and they should also be told that a prenatal testing is feasible in cases where the females are the carriers and they're planning a pregnancy. So long-term outcome is good if you follow all these symptoms, or if you follow all these protocols, that appropriate that going to the physician at the appropriate time and keeping under close follow-up, so as to just be on the lookout for development of new symptoms or signs.
Great. So thank you so much, Dr. Anand Narayanan, for joining us today at Medical Dialogues. It was lovely to be having you on board and gaining all your insights about this rare disease. And we hope through this we are going to spread awareness to as many people, and so that more and more people get diagnosed at an early stage. And then if it is caught early, then treatment is also started early. So definitely thank you so much for joining us today at Medical Dialogues.
Thanks a lot, Dr. Nida, for having me.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.